Hello everyone, thank you for tuning in today. The topic we are discussing is incredibly important, not just for healthcare professionals, but for anyone who may find themselves or their loved ones in a hospital. I'm here to talk about hospital-acquired infections, also known as HAI. This is an issue that's becoming an increasing concern in healthcare facilities around the world. Moving on, let's clarify what we mean by hospital-acquired infections, or HAI for short, commonly abbreviated as HAI. So, what exactly are they? According to the Centers for Disease Control and Prevention, are infections that a patient contracts during a stay in a healthcare facility. The key point here is that these infections were neither present nor incubating at the time the patient was admitted. Instead, they developed during the course of treatment for other conditions. Understanding HAI is critical because it helps us realize the importance of infection control measures within healthcare settings. Stay tuned for more insights on how to prevent these infections in our upcoming segments. What is an infection? Well, an infection occurs when microorganisms like bacteria, viruses, and fungi invade and multiply in the body. Now, these are called pathogens, and they might or might not cause harm. Whether or not you get sick depends on various factors like your immune system's strength, the nastiness of the pathogen, and environmental conditions. Infections can manifest in different ways. They can be acute, meaning they're short-term, or chronic, which means they last a long time. They can be localized to a specific part of your body, like a skin infection, or systemic, affecting your entire body. Let's talk about types of infections. Bacterial infections are caused by bacteria, examples being strep throat or tuberculosis. Viral infections are from viruses, such as the flu or COVID-19. Fungal infections arise from fungi, think athlete's foot or yeast infections. And lastly, parasitic infections are caused by parasites like malaria or tapeworms. As for the signs and symptoms, they can vary. Generally, you'll experience things like fever, fatigue, and inflammation. Specific infections have unique symptoms. For example, a respiratory infection might make you cough and have a sore throat, whereas a urinary tract infection could lead to painful urination. In this segment, we are diving into the various types of hospital-acquired infections, often abbreviated as HAI. These infections are a significant concern in healthcare settings and can have serious consequences. First on the list is catheter-related bloodstream infections, or CRBSI. These are severe complications that can result in higher rates of illness and death. The key to preventing CRBSI lies in proper catheter insertion and maintenance practices. So medical professionals must adhere to strict protocols when dealing with catheters. Next, we have ventilator-associated pneumonia, commonly known as VAP. This type of infection typically occurs in patients who are on mechanical ventilation. To prevent VAP, proper ventilator management and oral hygiene are absolutely crucial. Moving on to urinary tract infections, or UTIs. UTIs are frequently seen in patients with urinary catheters. Prevention revolves around appropriate catheter use and care, coupled with regular monitoring. And lastly, let's talk about surgical site infections, or SSIs. These infections are commonly seen after surgery and can cause a range of complications. To minimize the risk, it's essential to follow proper practices before, during, and after the surgical procedure. So there you have it, 4 main types of hospital-acquired infections, each with its own set of risk factors and preventive measures. In our upcoming segment, we're exploring the chain of infection, a series of 6 critical steps that explain how infections spread. Understanding and managing each step is crucial for infection prevention. Step 1 is the agent. This refers to the infectious microorganism or pathogen that initiates the infection. It could be a virus, bacteria, or other types of microbes. Moving on to step 2, we have the reservoir. This is the place where the pathogen lies and multiplies. It could be human beings, animals, or even inanimate objects like water or soil. Step 3 is the portal of exit. This is how the pathogen exits its reservoir. For instance, it could leave the human body through the respiratory, digestive, or urinary tracts, or even through open wounds. Fourth is the mode of transmission. This is the method by which the pathogen is transferred from one host to another. This could happen through direct contact, respiratory droplets, airborne particles, or even vectors like insects. Step 5 is the portal of entry, which is how the pathogen enters a new host. Much like the portal of exit, this could be through the respiratory system, the digestive system, the urinary tract, or open wounds. And finally, step 6 is the susceptible host. This is the person who is vulnerable to the infection. Various factors can make someone more susceptible, such as age, underlying medical conditions, or a weakened immune system. So there you have it, the 6 steps of the chain of infection.